According to the World Health Organization, 80% of diabetes, so type 2 diabetes, 80% of heart disease, and 40% of cancers can be prevented with 3 lifestyle changes. You have to eat right, exercise, and avoid tobacco.
Hello, everyone. We have today with us Dr. Nalini Saligram, founder and CEO of Arogya World, to share her insights on the current landscape of non-communicable diseases like diabetes in India and effective ways for its early prevention. Before we begin the impact talk today with Dr. Nalini, I would like to take this opportunity to introduce her. She is a passionate global health advocate with a hard science background and global communications experience. Deeply interested in making a meaningful contribution to global health, she's collaborated with like minded people and partners to engage world leaders and individuals alike in fighting non communicable diseases. As a result, her brainchild, Arogya World, was born in March 2010. The purpose of Arogya World is to create awareness and prevention of NCDs in India. Today, under her guidance, Arogya World is working across several states in India through its 4 key programs and a defined goal to reach 22 million by 2022. Felicitated with the Ashoka Award for her invaluable work on creating a lifestyle movement for chronic disease prevention, Nalini is a seasoned leader committed to fulfilling her vision of supporting and empowering everyone to live healthier lives. As a tireless advocate for NCD prevention, she not only leverages public private partnerships but also utilizes global platforms to improve the world we live in. Her professional journey began in 1986, and during this time, she has led corporate communication global teams for established healthcare brands like GSK, Merck, and Merial. Nalini holds a PhD in biochemistry from Indian Institute of Science, Bangalore, and she serves on the Dean's Council at Rollins School of Public Health at Emory University. It's an absolute pleasure to have you with us today, Dr. Nalini. Thanks so much for giving your time for this wonderful chat.
Thank you. Thank you, Lakshana. I'm looking forward to this conversation. Thanks so much for inviting me.
Thank you. It's a complete pleasure. So I'll quickly jump to the interaction that we've all been looking forward to. Starting with today's impact talk, my first question is that, given that diabetes is popularly misconstrued as, an old age problem, how would you describe the current scenario of diabetes in India across different age groups?
Yeah, Indians are very badly hit by diabetes. We are predisposed to diabetes. We have family history of diabetes. It really affects us more significantly than in any other country. We are probably second behind China in terms of absolute numbers, but I know that the problem of diabetes is very, very big in India. You were talking about age groups, so let's focus on that. Indians get diabetes 10 to 20 years earlier than people in the West. Okay, so if in America, people may get diabetes in their 50s. In India, it's people in their 30s who get type 2 diabetes. So we have some trigger, something that makes us get diabetes early. It's genetic predisposition, I think, that gets us diabetes so early, so young. So the other couple points I wanted to say is children and adolescents are also not free from type 2 diabetes. As much as 10% of our children as young as 5 years old are pre-diabetic. So they're going to get diabetes very soon unless they do something about it. Some 77 million adults live with diabetes now in India, and a similar number is supposed to be pre-diabetic and a similar number is supposed to be undiagnosed. So the burden is probably 3 times that 77 million number. So it's a huge number of people with diabetes. One other point about this early onset, India is a young country. India is median age is 27. And at 27, that the the person at 27 thinks they're invincible, they're not going to get any disease. They are at the peak of their innovation, their tech entrepreneur journey. They are, full of hope and life, and should be. They're 27 years old. But 3 years from now, they may start getting diabetes. And if they don't do something about it, they will, inevitably get diabetes very soon. And look at the burden of this public health burden then in the country. The country's already got under 5 childhood mortality. We have, maternal mortality. We have COVID. We have so many infectious diseases. And in the middle of all that, we have now the increasing burden from diabetes. So several reasons to be concerned. But yes, early onset is one of the really sort of big hallmarks of Indian diabetes.
Thank you, Dr. Nalini. That's actually quite, interesting to think about, given all the things that we've seen in each of our families and how diabetes is so common. But it's really nice to know like what the expanse is realistically and what can be done. Through a recent WHO report, it was observed that diabetes is a growing challenge in India, with an estimated approximately 9% diabetic population being between the age group of 20 and 70 years. And it's been realized that the type 2 diabetes has been alarmingly increasing amongst this. What would you recommend as the early stage prevention for this sort of a scenario?
Yeah. So let me first provide a few remarks on the percentage of prevalence of diabetes that you talked about, and then we'll talk about prevention. So the 9% is what you said, but some few decades ago, it used to be 2 and 3%. So
Wow.
now it is increasing. You're saying 9%. Some other reports I've seen say in urban India, it's between 20 and 25%. And in rural India, it's in that 10%, 12% range. In general, though, it's increasing rapidly everywhere. And in urban India, it's probably double in general incidence than in rural India. But surely, and then one other statistic to think about, in metros like Chennai, for example, studies have been done that show up to 3 out of 4, so either half or 3/4 of the adults walking around are either diabetic or pre-diabetic. Okay, so it's really, really an alarming problem, and it's increasing. So even if we take home nothing else, it is a huge problem, and it's increasing in all over India, is the take-home message. Fortunately, though, something can be done about this. We don't need a new vaccine. We don't need a new technology. We know what has to be done to combat this set of diseases. According to the World Health Organization, 80% of diabetes, so type 2 diabetes, 80% of heart disease, and 40% of cancers can be prevented with 3 lifestyle changes. You have to eat right, exercise, and avoid tobacco. So it's in our hands, right? It's healthy living. We know healthy living can combat 80% of diabetes cases. So we don't, it's the holy grail of diabetes control is preventing through healthy living. It's very difficult, though. It's very difficult to get everybody to change a behavior. And that's what, we have spent more than 10 years of our lives doing this prevention work at the nonprofit I founded. But prevention through healthy living is the solution, because you can't think about it. You can't treat your way out of these non-communicable disease crisis. It's very difficult to give medicines to everybody who needs it. In the world, 4 billion people are living with non-communicable diseases. How can you give cholesterol medicine to everybody who needs it? You just can't. So smart solution is prevention. Fortunately, these are preventable to a large extent. So we should focus on prevention as a population level solution to the current crisis that we have.
Thank you, Dr. Nalini. It was also quite self-reflective in terms of the fact that how this lifestyle has just grown on majority of the age group that we just discussed. And then, like in the coming years, it becomes very problematic. And it's the
Yes.
universal truth. We completely understand it. With Arogya World working on this specifically, I think congratulations on some notable work coming.
Thank you.
Uh, with your experience on Arogya World's work, what would you recommend as tested and the most effective ways of communicating about such NCDs to make a larger impact? Because I'm sure it's not the easiest topic to talk about because everybody is aware of it, but it's difficult to turn into a, actionable of sorts. So how do you manage that?
Absolutely. Absolutely. You got it. Everybody thinks they know
Hmm.
what healthy living means, but they really are confused or they don't know where to begin. And so, yes, it is
Yeah.
very difficult to get people to change behavior. So let me tell you how we are going about it. Okay. We believe that we should not be seeking prevention in the clinic. We should not go to a doctor's office to seek healthy living behavior change or prevention. The overworked and in a crowded hospital, the overworked nurses and healthcare providers really don't have time to give us this counsel, this lifestyle change counsel, and they should be spared to do the care for the really sick or the ones who need urgent medical attention. So we follow what we call a community-based doorstep health approach, which means taking prevention to people right where they live and learn and work. So we have prevention programs in school for school children, 11-year-old children in the school setting. We have programs for text messages and voice messages. We have it, which is very powerful. Right? You have to confront it. It's on your phone. You're looking at your phone the whole day, so you modern Indians will look at their phones. And then we have healthy workplaces, which make companies promote health in the workplace setting. And then we have a tool called My Thali that teaches people what to eat and in what quantities at every meal. And all of this is designed to get the child and the young adult and the young professional working in their first jobs to learn lifestyle behaviors that will prevent diabetes before they get to age 30. It's also for the old people who are pre-diabetic or diabetic, so even older people, slightly older people, because it can help. The same lifestyle changes can help you prevent the complications from diabetes. So people don't realize that diabetes leads to heart disease, leads to stroke, leads to kidney disease, leads to foot amputations, leads to blindness. So all these are complications of uncontrolled diabetes. So let's control diabetes. Then we can control the rest of these ramifications. So the doorstep health, community health model is the way to go about it. I think we start as young as 11 years old because we think we should set the lifestyle habits for that child before they acquire them. Let us teach them about healthy habits. Let's teach them why it's important to get healthy habits. And we have a very compelling age appropriate, say, I want to emphasize that the way we talk to different ages of consumers should be different. So how we talk to a child is through games and activities that they play. And that is why it's a lesson they don't forget for life. If they learn it at age 11, let's say it's a snakes and ladders game, and an apple is a ladder and a bag of chips is a snake, that 11-year-old child is not going to forget that lesson for life. And
Wow.
that's what we want to teach them, so that we set them up for a lifetime of health. That adolescent age group, 11, 12, 13, is very, very, very important, because that's when most of the lifestyle is set. Then we also get to the workplace, and the way we work with the workplace is a set of accreditation criteria that we get the company to change. So it's a systems change effort. If we want the culture of the company to become health promoting and data driven. And the text messages are a series of very powerful messages that we send twice a week. We did 1 million people with Nokia. We now are in, we've done 300,000 at Aravind. We've done 100,000 ongoing with LV Prasad Hospital. So in the community where there's a trusted partner, we are doing these M-diabetes, efforts. The My Thali, talk about consumer confusion. Nobody knows exactly what to eat and in what quantities at every meal. So that is what our My Thali shows. It's a picture that shows what a woman should eat. And according to the Indian guidelines, National Institute of Nutrition guidelines, this is how many chapatis, this is how much cooked rice you must eat. So we do that for all modern meals as well. We've adapted it for different cuisines that Indians eat these days. And we don't just stick to dal and rice, we eat a lot of foods. So we've adapted it. And we've also adapted it for rural adolescent girls. So in addition to these programs, we're also started a 5th program called Arogya City, and we're trying to get Bangalore to become India's first Arogya city. And we are really excited about this multi-sectoral collaboration to make a whole city, rise up and take up the challenge of this NCD burden, reducing NCD burden. So it's an evolution. So schools, text messages, social media, workplaces, and now cities.
No, thank you. It's been quite lovely to hear the approaches that Arogya World has taken, and especially the My Thali bit, because I'm sure that it is a challenge, and I know for a fact a lot of people who struggle with this sort of a thing. So thanks again on such wonderful work. This brings me to I think my last question, given what I've heard from you. In the next 5 years, how do you see Arogya World as a platform looking at furthering the health mission in India?
Yeah, thank you. So this doorstep health model, I think, is showing traction and is probably worth examining as a way of, sort of tackling NCDs on a population level in India. So whether it's text messages or it's community-based or working with partners, using the frontline workers of everybody else, the government as well as NGOs, getting more and more people to be reminded about healthy living in a structured and systemic fashion would make sense to me. This doorstep health model, I think, is really encouraging. So where we want to go, we have reached, this is the 75th year of India's independence. And in this year, we have reached 7.5 million people across all our programs, across all of India. At least 1 million of them are really at the base of the pyramid. They live on less than $5.50 a day. That's the World Bank definition. And so we really, want to uplift people from poverty. One of the ways to do it is to improve their health. So that's how that is the approach we are taking. And it is important for everybody's health to rise so that we can prevent the next pandemic, we can build India back better, we can meet the sustainable development goal number 3 and get India to be the economic powerhouse it is. Because otherwise diabetes is going to cut a lot of the productivity out of the working years of a person's life. So we ourselves have set us a goal. You said 22 million in 2022. Well, COVID came in the way, so we're not quite at 22 million by the end of this year, but we've set ourselves a goal of getting to 50 million people across all our programs in 5 years. So, and we feel we're well on our way to do that because we have some major partnerships that we're very excited about. So essentially, community-based health education that can prevent diabetes and improve the health of large numbers of people is the solution.
Thank you, Dr. Nalini. I think it's very inspiring to see you promote healthy living like you do, and not just like in conversations, but walking the talk in terms of the programs that Arogya World is doing and how it all aligns with the larger goal of the 2030 agenda with the fulfillment of SDG 3. And it's been quite an enlightening conversation. This brings us to the end of our Impact Talk. Thank you so much for such an enriching conversation. I'm sure this is something that will continue to inspire more and more people. And we wish you the very best in terms of.
Thank you, Lakshana. It was a, really great effort on your part to put a spotlight on NCDs, because surely this issue deserves to be talked about and addressed. Thank you very much for the opportunity.